Hey, Allie. We're going to give about 2 minutes and hope that a couple more people start rolling in. All right, so we will go ahead and get started. If more people start rolling in, that's great. I would like to welcome everyone this evening to the first webinar in our series. This one is the postpartum experience navigating baby blues, postpartum depression, and postpartum anxiety. I would like to introduce myself. My name is Claire McCubbin, and I will be leading this webinar this afternoon. I want to thank everyone for joining after long days of children, work, wives, husbands, all of the above. I'm really glad everyone was able to get a chance to join in here this evening. I would like to tell everyone that this is being recorded and we will be posting it. And I like to tell everyone as well that we will be sending out all of the slides to everyone who has enrolled in this webinar this evening. At the end, I have a good amount of just resources, links that people can use if they feel it's going to be necessary to just learn a little bit more. So we can just go ahead and get started. So I'm going to talk a little bit about myself first. As I said, my name is Claire McCubbin. I am a licensed clinical social worker in the state of Maryland and Vermont. I have been practicing with Stride Forward Counseling now for about 3 years. I have a couple of specialties. I specialize in depression, anxiety, eating disorders, and postpartum experiences. I like to talk a little bit about myself and the amazing and cute little boy to the right of your screen. That is my son. He is 2 years old and he is truly the light of my entire life. I don't know what I would do without him. I want to talk a little bit about my personal experience with postpartum to just kind of set the mood, right? And to also share that even though individuals who, such as myself, I am a professional in mental health, right, does not mean anyone is exempt from developing any sort of mental health struggles, right? So a little bit about that experience. So I had a normal pregnancy, normal birth, everything atypical. I didn't have any major medical concerns, right? Everything went well. Um, it was my last day at the hospital, and I remember, getting discharged. It's scary, right? It's a scary feeling getting discharged from the hospital. Um, you have a lot of support in the hospital. I knew if anything happened while I was there with the transition to now being a new mom, right? I had nurses, I had doctors, I had midwives, right? I had that support there. So that was a scary thought, right? One thing that really sticks out to me that I think is important to say is, my very last day, I'm about to get discharged, I think in a couple hours. The final midwife comes in and, is doing the normal checking, right? Talking a little bit about discharge planning, like what it needs to look like. And then he says, he takes me and he says, look, if you think you're going to hurt yourself or hurt your baby, you need to let someone know, right? I was shocked, right? It was one of those things that being a mental health therapist, of course, I know that there can be things that happen post-birth, right? I know that these things can happen. Wasn't gonna happen to me, right? First thought in my head, "Oh my gosh, that could never happen to me," right? Um, you don't ever think anything's gonna happen to you. He said it also so nonchalantly, right, that, "Oh, this is something that not a lot of people deal with, right? I'm not going to deal with it either," right? So that was, one thing that kind of just stuck out to me. It was my first night home, and, I remember just sitting and crying and crying and crying uncontrollably. My husband didn't know what to do. He didn't know how to support me. I didn't even know why I was crying, right? I didn't know why I was so upset. Um, After that next day, same thing, right? Crying, uncontrollable, right? Completely out of my control. And I think that that was probably the most scary part. It was really these thoughts and these sadnesses were really out of my control, right? I remember walking into my bedroom, and same thing, I'm just kind of crying uncontrollably. My mom comes into my bedroom, she hears me and she sees me. My mom is the best support person that I could ever have, and I'm so thankful for her. Um, she comes in and she says, "Claire, you need to call your doctor." Right? Again, shocked. A thought that did not even cross my mind. And I don't know why that was. I talk to clients and I talk to individuals, right? And always talking about if you need support, you need support and you need to reach out for support. But it wasn't a thought in my head, right? Um, so another reason why I like to share this story is the support systems that you have in your corner, especially while you're going through an experience such as this, is so incredibly important. I am very, very fortunate that my mom is also a licensed clinical social worker, right? So if she thought that I was going to hurt myself or hurt someone else, right, hurt my baby, she would EP me, right? She would make sure that I was able to get to a hospital and get the support that I need, right? So that was also maybe why I didn't think that I needed to call my doctor. Like, oh, well, my mom's got me, right? My mom is the enough support for me. She wasn't, right? And that's nothing towards her, but I needed more. Um, so I call, right? That same, I called when she was in my bedroom with me. And it's the University of Maryland. I had great experiences with them. It's a call center though when you call. So they call and I tell them I'm hysterically crying throughout all of this. Um, and they say, okay, like, please hold. They say, hey, I can get you in tomorrow. I say, great. Okay, awesome. So I make an appointment. And my mom looks at me and she says, oh my goodness, they didn't even ask if you wanted to hurt yourself or hurt your baby. I say that to say, and maybe it was just this person, right? Maybe they were new, right? Maybe they weren't aware, right? But how little talk and education there is on that and how important it is, right? As I said, I'm so fortunate that I had my mom, and if I was experiencing those thoughts, she would do something about it, right? Not everyone has that, and not everyone knows that. So I say that to say also opening to, right? This conversation is so incredibly important, right? To talk more about this, because a lot of individuals who go through childbirth are suffering in silence, right? So something to just think a little bit more about as it relates to that. And then we will get started. Okay, so we're going to talk a little bit about why this is so important. There are so many reasons why this is so important, right? This is just a few of them. We're going to think about 20% of postpartum maternal death is by suicide, right? That's 1 in 20, right? That's a lot, right? And that's really scary when we think about these things. We've also seen over the last decade that suicidal thought and self-harm has tripled, right? And I think that there are a lot of reasons as to why that is the case. One of them being, right, um, maternal mental health and mental health in general is just being discussed more, right? We have done, I think there's still a lot of work to do, but we have done a lot of work as it relates to mental health, opening the floor with being okay with mental health being a subject that we talk about. So maybe more individuals are just discussing with their providers, right? They're just discussing with more people. So that could be it, right? We don't know if it's just suddenly changed over the decades or if we're just learning more about it. Um, so we are also going to see that maternal death by suicide, that is also more prevalent than postpartum hemorrhage or hypertensive disorders, right? So again, those medical issues after childbirth that are so prevalent, we're going to see maternal death by suicide is actually higher than those things. Um, we're also seeing that there are more violent methods used compared to non-perinatal individuals. What that is telling us, right, is that individuals going through this, for lack of better words, want to get the job done, right? They don't want to have any thought as to what's going to happen if this doesn't work, right? And that's scary. I think that that shows also, right, how intense and severe some of these thoughts and some of these thoughts are, and why it is so incredibly important to talk about. Hormonal changes, right? The hormonal changes is something that is really important for us to discuss as well, to just, again, open the dialogue for individuals who are either going through this experience, right, or have people in their life who are going through this experience, right? Um, I remember us with my provider, and I had regular provider appointments. Not one time did we talk about the hormonal changes that could happen after birth, right? Again, maybe we can make the assumption, right, that something could happen, but that's so out of your radar, right, when it comes to some of these things. So providers are not even talking to us about it, right? So the hormonal changes that we see after birth, it's a 180, right? It's such a flip, right? So with those drastic hormonal changes, we can see just an increase in some of these negative mental health symptoms. With the hormonal changes as well, I like to say, this is not something that will suddenly, quote, go back to normal after, 6 weeks to 3 months, right? What they say is after what is maternity leave, right? These concerns, right, and these hormonal changes can last up to 2 years following birth, right? So also, if we think about kind of stacking children and having more children in a smaller amount of time, right, we can see these issues continue, right, and these concerns continue. So what this means also is getting back to baseline. So we're seeing baseline, whatever that is for you hormonally after 2 years. That's a really long time to not feel like yourself. And that can really impact your mental health. It feels like a completely different person, which again is why this is so important to discuss, that even if, right, we can say that this is normal, and you'll hear me say a lot throughout this webinar that I don't always like the word normal, right? Because we don't want to normalize these things so individuals don't get help. We want to normalize so people can feel validated, right? That these things in which I'm going through, other people may be going through as well. So again, just a couple of things as to why this is so important among many other things. So I guess I will also start, right? We have actually 4 things that I'm going to talk about today. The baby blues, postpartum depression, postpartum anxiety, and I'm going to talk a little bit also about postpartum psychosis. Postpartum psychosis, I'm not going to talk too much about. It is pretty rare, but I am just also going to talk a little bit about that. So the baby blues are pretty common, right? Approximately 4 out of 5 are experiencing the baby blues following birth, right? So again, it's not normal, right? But it's pretty common. Symptoms can start 3 to 5 days after giving birth, and they can improve within the next few weeks, right? So it can be seen as temporary, right? Which could also be a reason why not a lot of people get help with the baby blues, right? It is temporary, which can be good, right? But that doesn't mean that it's any easier to deal with and to manage. I like to kind of give also kind of comparing baby blues and postpartum, and I'll go a little bit more into this as I talk about postpartum, right? Baby blues is kind of surface level, right? So we're seeing the sadness, excuse me. We're seeing the sadness, the anxiety, the irritability, the difficulty sleeping. We're seeing these really surface level symptoms, right? It's not really digging in. Postpartum depression, right? we're going to see some of these, of course, right? But it's going to be much more vulnerable feelings, right? It's going to be a little bit deeper than surface level. So again, we'll talk a little bit more as we get into postpartum depression. With the baby blues, I like to also say that there is no crystal ball that tells you that you're going to get the baby blues, right? There's no crystal ball that tells you that you are going to get postpartum depression, to postpartum anxiety, right? Just because you have one does not mean that you are going to get any of the other ones, right? So that is something to think about as well. So now I will talk a little bit about postpartum psychosis. As I said, this is pretty rare, right? Globally, 0.089 to 2.2 or 2.6 per 1,000 births. I'm not sure what that would equate to in actual births, right? But we can see it as pretty rare. Some of the main symptoms that we're going to see are hallucinations and delusions. With postpartum psychosis, right? We're going to see two a lot of the times, right? We're going to see a history of bipolar disorder, a family or a family history of all of these things, but bipolar disorder, any sort of psychosis disorders, schizoaffective disorder, schizophrenia, right? So if you have a history or a family history or a personal history of that, we're going to just see that being more likely that you could develop postpartum psychosis. It's also more common with the first child. Again, that does not mean that if you have, if you're on your third child that you cannot develop it. Just something to just keep aware of, or to be aware of. Some other symptoms that we're going to see with postpartum psychosis, right? Again, we're going to see across all four of these, some of these symptoms are going to kind of be the same. We're going to see that, and that's completely normal. So depression, feelings of guilt, right? Loss of appetite, thoughts of self-harm, suicide, right? So we're going to see some of these things with postpartum psychosis. We're also going to see, again, these same hormonal changes that can be brought on by hormonal changes, the postpartum psychosis. Psychosis can also be seen as short-term or long-term. You will see too with a lot of these things in which I am talking about, right? It is not a one-size-fits-all. Of course, there are guidelines and there are things that we can go off of, but it is not a one-size-fits-all. Next slide, please. Thank you. So this slide, again, is going to kind of emphasize some of those differences between the baby blues and postpartum depression. And I'm going to go back to that baby blues surface level, right? Mood swings, anxiety, sadness, feeling really overwhelmed. You're crying a lot. There's not a lot of concentration, difficulty sleeping, right? Postpartum depression, if untreated, right, can last months or longer, whereas baby blues, a few weeks, right? And we're going to see a lot more vulnerable symptoms as it relates to that, right? So you're not feeling connected to your baby, right? You're withdrawing from people, you're isolating, right? You're losing interest in things that you once enjoyed, right? There's feelings of worthlessness, shame, guilt, not a good mother, right? I can't be a good mother for this baby. I don't know how I'm going to do this, right? Also thoughts of harming yourself or harming your baby. So again, these are just some of the things in which we can see in the differences in baby blues and postpartum depression. And then next slide, we will be getting a little bit more into postpartum depression. So with postpartum depression, again, we're going to see some of the same symptoms as the baby blues. It's going to last a little bit longer than 2 weeks, right? These feelings are also going to intensify, right? Baby blues, yes, is very intensive, but we're going to see them intense for much, much longer, right? So frequency of the intensity, and then they're just going to last a little bit longer. The Oxford definition of postpartum depression is depression suffered by a mother following childbirth, typically arising from a combination of hormonal changes, psychological adjustment to motherhood, and fatigue. I like to put that in there, right, to talk a little bit also about the fatigue aspect of postpartum and your postpartum experience. I think lots of individuals can, again, make the assumption that they're probably not going to sleep a lot when the baby gets here, right? I made that assumption, absolutely, that I'm probably not going to sleep much when my baby is here, right? But what I didn't think about is the compacted and the long lasting of lack of sleep, what it's going to do to my mental health. As therapists, we talk so often and so frequently, right, about sleep, how important sleep is for an individual. Not just because we know that it's important, right, but because we know that it can have lasting impacts if we are not getting the sleep that we need. Um, I think that this is a really challenging part with the postpartum population, right? Because again, it's normal, right? It's common to not get sleep when you have a newborn, right? So it can be hard to say that all of these things are, again, okay, right? Just because this feels normal, right? Um, so something to just think a little bit more about. With postpartum depression, too, again, we're going to see some anxiety, some sadness, right? Anger, irritability, difficulty sleeping, intrusive thoughts, right? Intrusive thoughts is a pretty big one that a lot of individuals suffer with following the birth of a child. And if, again, common, right, doesn't make it okay, and it doesn't make it any easier to manage those things. With postpartum depression, too, it can last up to 3 years following the birth of a child, right? That's a pretty long time to be suffering with postpartum depression, especially in a society where, right, we are told after 6 weeks you're good to go back to work, right? Does that suddenly mean that we feel better after 6 weeks? Absolutely not, right? So something to think about also that this can last up to 3 years following the birth of a child. Um, and one more thing, again, this is 1 in 7 women, right? So we can say that this is pretty common. With this, it's really challenging because, how many individuals do you know that have gone through the postpartum experience who will open up to you about these things, right? Probably a lot more than you're aware of. Next slide, please. So just some signs to look out for postpartum depression, right? So a lot of crying, right? So we're excessively crying and we're not sure why, right? There are no reasons behind this. And it feels really out of control, right? No matter what I do, this crying is not happening, right? Sleep troubles. Again, we have to kind of take this with a grain of salt, right? That if your sleep troubles are simply because your baby is not sleeping, right? Or if it is truly a change within yourself and your sleep schedule. Detachment from your baby. So feeling like I cannot connect with this baby. And that's really confusing for new mothers, right? That how can I love this little thing so much and have all of these feelings and not feel connected to them? Brain fog, right? So lots of problems with memory. I think throughout pregnancy, the brain, I'm not a scientist, right? But the brain shrinks about 6% during pregnancy, right? So the brain fog, right? It makes sense because our brain is not where it used to be, especially prior to pregnancy, just looking at our baseline. Mood changes. So unexplainable mood changes, and that are really, really quick, right? And something too that you are maybe seeing as a concern, and something maybe that also your partner is seeing or your support systems that you're seeing are a concern. Eating problems, right? So you're not eating the same as you used to. With postpartum depression, and some of these differences again between baby blues and postpartum depression, with the baby blues, right, we can see a shift just because the baby blues is 3 to 5 days after birth of a child. We can see that natural shift in eating, right, just because of the hormonal changes that we're experiencing, right? With postpartum depression, we are seeing longevity with this. So you're now going weeks and months eating more than usual or not eating as much as usual. So again, thinking too about your own baseline, what it typically looks like, and we're going to see this as something that is very different. All right, so now we're going to talk a little bit about postpartum anxiety. So with postpartum anxiety, right, we're going to see again excessive worry, right? And this is something that occurs after childbirth or adoption. Right, so something to remember that this is not just after childbirth that you can experience this. This can also be after adoption. So, with some of these symptoms, right, that we're going to see, a lot of them are foundationally surrounding the safety of your child, right? So some of these things that we can see are, you avoid public places because you're worried something is going to happen to you, to your baby, right? You stay up all night with your baby because you're worried that they're going to stop breathing in their sleep, right? You're worried about something is going to happen to them. Being scared to leave your baby with a trusted adult, just even for a few minutes because you're worried something could happen to them. And unwanted or scary thoughts surrounding your baby and what could happen to them. Right. So this is all consuming. Right. So we are seeing this again, it is one of those things that feel really out of your control. No matter how hard you try, you just cannot stop thinking about these things. Um, We're also going to see this. 1 in 5 individuals who go through childbirth are going to see these symptoms, right? So again, excessive worry long term, right? What is this going to do to us, right? Our body's visceral response is going to be for long term, right? Stressed and worried, right? I remember I was talking to a client who has a 15-year-old, right? She was telling me I still wake up right in the middle of the night because I'm worried something is wrong with my children and they're 15 years old, right? So the visceral response that we can also see from an extended period of stress does not simply go away when your children are older, right? It still happens and it still is really important to think about and to talk about. So how do we help? Right? So a couple of things in which we can do to help. The first one is having regular prenatal care with your doctor. Um, to be able to monitor, yes, you physically, but then also mentally as well. I like to tell every single one of my clients, right? Talk to your provider about some of these things. I I really like saying that and talking to them about it because I did not talk about any of this with my provider, right? Nothing was talked to me when I was going through, right, 10 months of pregnancy, like, hey, these things could happen post birth, right? So talking to your doctor regularly about these things. Um, Building a support network, right? I say too, right? Why I share my story is how important your support network is. Um, them being able to see things that maybe you do not see. Because lots of times too, as it relates to postpartum, right, we can be really, really blinded by a lot of these things. And we just have tunnel vision, right? We're either taking care of our baby or we're thinking about all of these thoughts, right? The support network can really, really be a great support for you, right? To just help you kind of get through it, but then also say, hey, it seems like you're not acting like yourself, right? Um, so incredibly important. And with the support network too, I like to say, right, that this can be prenatal and then also postnatal, right? So building a support network while you're pregnant is great and that's amazing. And sometimes it works, sometimes it doesn't, right? But also being open and willing to building your support network after your baby is born. Taking care of yourself. Um, Again, self-care on this slide, it says self-care is very important. And I would say, yes, it is. I do not know, though, if self-care is an appropriate word as it relates to being postpartum. I say that to say, taking care of yourself is going to look very, very different for every single person. One thing that you see a lot of that everyone says, take a shower every single day after the birth of your child, right? It's 5 minutes to yourself that you get to yourself. I remember thinking, this is not me taking care of myself, right? This is me being away from my baby, right? And this is not effective for me. I'm sitting in my shower and I'm sad and I'm crying and I'm worried, right? Is something going to happen to me, right? Of course, I knew I had to shower, right? But it wasn't necessarily self-care and it wasn't me taking care of myself, right? So these things are never going to be a one size fits all with taking care of yourself, right? And self care, whatever that means for you. Figuring out what that is really important. And it can be something very, very small, especially with your first child. It's really important to figure out what it needs to look like for you to help manage some of those symptoms. So I say something even as small as I'm going to take my time drinking my coffee while holding my baby, right? Like this is taking care of myself. Taking care of myself is not anything else other than this. Talking to your partner. This is so incredibly important to do. If you do have a partner who's going through this experience with you, opening the conversation surrounding the postpartum experience is so incredibly important. Um, Whatever that needs to look like for you, it needs to look like for you. As it relates to boundaries that you need to have, maybe with other people, other individuals in your life, letting your partner know what are your boundaries, right? I don't want anyone holding the baby. I don't want anyone kissing the baby, right? Whatever that may be, being postpartum, it can be really, really challenging to say those boundaries to people, right? Again, blinders on, you're seeing one thing, you're overwhelmed already. You don't want to think about having more conversations with people about boundaries, right? Um, so putting something on to your partner, right? Allowing your partner to take the reins on something as small as that, if you feel like it's going to be really beneficial for you. With talking to your partner, another thing that I do like to say is sometimes you don't know, being postpartum, what it is that you need, and that's okay. You don't have to know exactly what you need, right? But sharing that with your partner, right? I don't know what I need. I just need you to hug me, right? I just need you to tell me that everything is going to be okay, right? I need you to wash the bottles, right? Whatever it is, figuring out that really small thing can do a lot in a relationship, right? It's going to build you and your partner, right? But then it's also going to help support you throughout this. Um, Communication, we know, is so incredibly important, right? But especially being postpartum, right? It's going to test relationships a lot because your partner is going to probably see you in a light that they never saw before. And that can be really confusing for them, right? Like, how do I support this person? I've never seen them go through this before, right? So opening these conversations with your partner beforehand can be really, really beneficial. Um, One other thing that we can do to help is seeking professional help, right? So on top of, right, talking to your provider, right, who maybe who saw you for the 10 months, right? But also seeking that outside of your provider if you feel like it's necessary. I will say your provider should your OBGYN, right, your midwife should be able to send you referrals or resources um for a therapist, for perinatal or postpartum therapists. So ask, right? Something to ask for if you feel like it's going to be way too overwhelming to try to find a therapist. Outside of that can be really, really beneficial. Um, One other thing that I like to talk about is how do we help, right? We can use medication as a tool. So I will preface what I'm about to say is I am not a psychiatrist, I am not a doctor, but I do know that some people find medication as a tool that we can use. There is actually so this is treatment for the baby blues. It is the first FDA approved medication. It's a short-term medication. Something to talk to your provider about. I'm sorry, I cannot say what it is called, but these slides will be here for you. There is short-term medication that is FDA approved, that is marketed, right, to work within 3 to 14 days. Short term, it's 14 days that you're taking this medication. So again, if you feel like tube medication is going to be a tool for you, talking to your provider about it. This medication is relatively new. I think it came out like the month that my son was born. It got FDA approved. My provider didn't know anything about it. So something too, it is going to be specific for you and what your provider is comfortable prescribing you. Another thing that we can do is understanding the role that stigma plays, right? Um, there are lots of stigmas in the world, I think, especially surrounding postpartum. Um, that social media doesn't do a great job at helping us navigate those things, that we see one side. And especially as new mothers, we are new individuals, new parents, right? We want to be the best version of ourselves that we can be. And when we see someone who is seemingly doing that online, right, it's really, really hard for us to get out of that, right? So understanding that even if there is that stigma that you need to have a perfect house after your kid is born, right? You have to be able to handle your mental health perfectly after your kid is born, right? um that these things are not things that just simply happen, right? With social media, you have to take it with a grain of salt that lots of times people show you one side of them, and that is all that you see, right? So being okay with with challenging that, it's going to be incredibly important. It is hard, right? It's really, really hard to want to seek out help, especially maybe if you've never done it before. And that's okay. It shouldn't be easy. But taking these very small steps can lead to better management, right? And we can just really help see a decrease in some of these symptoms. Um, one final thing I like to say just about how do we help others. And this kind of goes along too with um having your partner and your support system in on this as well, as understanding the invisible load, right? The invisible mental load that plays with being a new parent, right? I remember postpartum, I had an individual in my family say, "I never knew you were suffering with those things." Right? So this invisible load that we can sometimes carry, because again, society tells us you need to be happy and you need to be excited because your new baby is here, and that is just not the case. I can say from personal experience, I was super excited, right, for my baby to get here. But after he got here, it was hard, right? I was challenged in so many ways, right? That I felt like I had to hide because I should have been so excited that my baby was here and in my arms and I was taking care of him, right? Um, with that, it does get better. And I know that that is not saying much. I heard so many people, so many other moms, partners tell me, "Claire, it's going to get better," right? And that didn't mean much for me then, right? Because I was just trying to survive. Right? And if you all you can do is all survive, right? Then that's all that you can do. And being okay with not believing it's going to get better, because that's a scary thought, right? Oh my gosh, I'm going to have to now know a new version of myself following this really challenging version of myself, right? So being okay with it not being okay and not sure that it will get help, will get better, and when will it get better, right? But if all that you can do is also reach out, try to get help, try to get the support that you need, that's a really, really good place to be. So some resources, as I said, these will be posted just so you can kind of have this in your back pocket. So a couple of really great resources. So the National Maternal Mental Health Hotline, right? So that you can call 24/7. This is perinatal and postnatal, right? So just getting support by calling the number. March of Dimes, right? Focused on improving health of all mothers and babies. Shades of Blue, which is an organization helping women of color before, during, and after childbirth. The Postpartum Support International, which is again nationally known. And then also, if needed, the suicide hotline is there too, right? So texting or calling 988. Um, Another really, really great resource that I personally loved and I talk a lot about as well, is the book Good Moms Have Scary Thoughts. I really, really like this book because, especially postpartum, right? If someone were to tell me, "Hey, Claire, sit down and read this book," a couple weeks postpartum, I'd be like, "Absolutely not," right? This book, it is more of an illustrative book. So there are a lot of really great illustrations in there that talk more about these things and these issues. So again, and it's very easy to read, which is really good for postpartum. It's great also if you want to be able to read these things before the birth of your child. So again, just some resources that we do have and a lot of people offer. And again, having these resources is great, but making sure that you're utilizing them when they can is the next part of that. And that is the end of what my webinar. If anyone has any questions, I would love to take them. If you need to think about it and then send an email, that is also fine. But if anyone has any questions, please feel free. One question that I did actually get prior to the webinar that I think is also really important to talk about, is dads, right? And also how they can be impacted by some of these things as well. And I think that that is also something that is incredibly important to talk about too, right? So as it relates to baby blues, right? The baby blues, we're going to see those hormonal changes. So the dads or the other partners may not experience that just because they are not the ones going through the hormonal changes, right? Same with postpartum psychosis. Also, but as it relates to postpartum depression and postpartum anxiety, right, that can be seen in either parties, right? Acknowledging too that, this is such a hard transition for everyone in the family now, that yes, I think sometimes too, the individual who gave birth to the child is first runner, right? That we're going to support them and we're going to do what we can for them too, which I think is absolutely important to do, right? But also acknowledging that the men in your or your partner, right, can also be suffering with these things. So if that is the case for you as well, being a partner to that individual, right, again, we're going to seek out those resources where we can. I will say there's not too many resources as it relates to partners, right, or dads going through these things, but they are available. So if you think too that is going to be of a support for you, please feel free and make sure that you are doing that as well.
Thanks, Claire. Appreciate
Hey.
that.
Yeah.
Throwing that question in for the male perspective as well.
Yeah.
But just wanted to thank you for doing this webinar today. Excellent content here, and even to hear your own story, really impactful through the whole process here. So we really appreciate you going through this process and educating others out there about postpartum. So I think unless we hear any other questions, we'll call it a wrap. And any folks that did register, we'll get the slides out to them and some additional notes as well. And we'll go ahead and post this on YouTube and other areas as well, so that folks can use this as a resource moving forward. But thank you very much, Claire. And thanks for those that attended today. And we'll call it a wrap from there.
Thank you so much, everyone. Have a great night.
Have a good evening. Bye.